this session, MSc Mastery live session. In case you're receiving this as a replay, okay, we'll be doing revision of what we did in the last live session, and we'll also be doing revision of some of the things we may have done in the video we may have made, as well as the short we have made. So we believe you that is listening to this in this live session, and then you that will be playing it back, you have a reason to start from scratch to mastery of a certain concept. Is that okay? All right. Thumbs up if you are with me, and then drop a comment if you understand that. So, without much ado, let's dive
Yes,
into
sir.
the study. Do you follow? Now,
Yes, sir.
anatomy. We are still looking at anatomy. Today is 24th of July, and we are still looking at anatomy. Now, anatomy, okay, is one of the courses done in preclinical class. It's one of the topics or courses done in the first year of preclinical class and the second year of preclinical class. Okay. Now the course is made up of, okay, the course is made up of number one, anatomy of upper and lower limb. Sorry, anatomy of upper limb. Okay. Anatomy of lower limb, general histology, general embryology, practical anatomy. Okay. Now that is for the first in course, what the BSc students or BA students or BE medicine, they say you do 3 semester or they call it in course work. Semester in pre-medical, preclinical medical school is not the same with that of the BSc school. Do you follow? And that's not our point of
Yes, sir.
interest. A point of interest is we want to look at anatomy. Now, the in one that occurs in second in coursework is TAP, that is thorax, abdomen, pelvis, and perineum. Okay. Now, you also have systemic histology, systemic embryology. Now, we also have moving away from there, we also have head and neck. Of course, there's practical anatomy in your second in course too, where you dissect the thorax, abdomen, and perineum, pelvis also. Then for your third in course work, which is usually in year three, you talk about your third in course work, you talk about we talk about the head and neck. Head and neck is still part of anatomy. Okay. Then in the so for head and neck, okay, that's a third in course work. We also have neuroembryology. You also have, all right. Some people finish their histology, others take session. All right. So This night, we want to start with review of some of these things. We have already are you paying attention? I said we've already done so we've already started studying. Not today we want to study. However, we may be doing sessions, live sessions, and recorded sessions in topics and areas, okay, that subscribers comment demand. That's why we expect people to make a demand or two on areas you need understanding. Do you follow?
Yes, sir.
All right. So now we talk about the anatomy has about 48 topics you need to look at. Okay. There are a lot of bones, about six, about 20, 13 of those topics is on bones. And there are different bones, about 120 bones in the human body, in the human upper and lower limb, not even the whole body itself. Ehen. So, but is discussed, okay, in 6 weeks out of the 25 weeks are supposed to talk about the anatomy. And then we said you can use 17 topics. Okay, you can fuse all those bones and call it one topic. So, like I said, so I like, yes, there are fewer ways you can study those large number of topics. Please try and mute your mic when you want to answer. You unmute, okay? So you don't it doesn't re-echo from here. Do you follow?
Yes, sir.
All right. So we said, please never ask very old student questions. Many fail comprehensive joint board exams because brachial anatomy always feel challenging. Now this is the mnemonic, okay? One sentence that as you keep using it, as you keep using it, so I use this sentence and I use it every time. I teach this out to over 270 so far in the past less than 1 year of learning, studying with people. Okay, and you too can learn it. When you learn it, you keep languaging it, you keep expressing it, you keep articulating it, you keep reusing it, and guess what? It becomes your nature. You can never forget, even if you want to forget, Please never ask very old students question, many fail comprehensive but comprehensive joint exams. Why? Because many because brachial anatomy always feel challenging. That's 17. This 17 topics, P stands for what? Popliteal and cubital fossae or popliteal fossa and cubital fossa. Do you follow?
Yes, sir.
Comment if you follow. Yeah, comment if you follow. Yeah. Now the next one is N. Never. Never stands for nerve, okay, or nerve plexus. Can say nerve supply or nerve plexus. Okay. A stands for arteries, okay, slash anastomosis. A stands for arteries slash anastomosis. Then very stands for veins slash venous drainage and also lymphatic drainage. These are key areas examiners pick interest in. Next, we have O stands for organs. The next one is spaces in bracket quadrangular space. That's why we say study question. A study is for space. The QD is example of a space. Many stands for muscle. Many stands for muscle. Fail stands for FRAS. Fail stands for FRASCH. FRASH. Now what that means is femoral ring, femoral artery, femoral sheath, and femoral canal and femoral hernia. The sheath is SHEATH, not the SHIT. Ehen. The joint refers to joint, for example, elbow joint, shoulder joint, and you can mention one. Can you type one joint or you mention one joint? You know? Eh? Knee joint, elbow joint. Yes, my guess. What's the other joint? That's a type of joint, not an example of joint. Ball and socket joint is a type of joint. What did you say? So there are a lot of joints, interphalangeal joints, okay, makeup, a lot of joints. So when we talk about it, you know. Next one is breast slash mammary gland. Is a topic, very big topic, serious topic. In fact, one of the dreaded topic in upper and lower limb by pre-clinicians. One of the dreaded topics. Next one is bone. Okay. The upper and lower limb alone has about 120 bones. 6 weeks is dedicated in most schools. Out of 25 weeks of studying upper and lower limb is dedicated to study bones alone. That's how serious bone is. Yet, you're going to see trick and hack and say very simple way of approaching bone. Once you understand that, off you go. Any bone they give you, you can discuss it. You can describe it in exams. You can explain it in clinical situation, even in clinical posting. It's a foundation that if you get it right, ah, you springboard. Okay. So the next one is brachial plexus slash other plexuses. We talk about anatomy stands for axilla. Anatomy stands for axilla. Okay. Whereas always stands for arches of the foot. Phil stands for femoral triangle And then C there stands for classification of joints and other anatomical planes, regions, and terminologies. I'm going to go over it again at least twice. The mnemonics and what they stands for. I said the mnemonics is please, never, ask very old student questions. Many fail comprehensive joint board exams. Many fail comprehensive joint board exams because brachial anatomy always feel challenging. Because brachial anatomy always feel challenging. I'm going to say that mnemonics again. Please never ask very old student questions. Please never ask very old student questions. Many fail comprehensive joint board exams because brachial anatomy always feel challenging. Please never ask very old student questions. Please never ask very old student questions. Many fail comprehensive joint board exams. Many fail comprehensive joint board exams. Why? Because brachial anatomy always feel challenging. Because brachial anatomy always feel challenging. Then I'm going to run through what those mnemonics stand for. Okay? And this is a very usual saying in medical school. Eh? When somebody stays in medical school for a long time, becomes a very old student, you don't ask them question. Why? He has failed comprehensive joint board exams. Why? Because this brachial anatomy is the most difficult. Eh? After muscle, the next difficult thing in anatomy is nerve supply. Okay? Now we move on. What does please never ask very old student question stand for? Many fail comprehensive joint board exams because brachial anatomy always feel challenging. Now, please stands for popliteal fossa and what?
Brachial fossa and cubital fossa.
Never stands for nerve or nerve plexus. Never stands for what?
Nerve or nervous plexus.
Now, A stands for artery and anastomosis. A stands for what?
Artery and anastomosis.
Very stands for veins
Veins and
and venous
venous
drainage
drainage.
and lymphatic
Drainage.
drainage. Do you follow? O stands for
Yes, sir.
OD stands for organs. Please drop comment if you are replaying this. Okay? Uh-huh. If you are replaying this, you drop comments. If you replay it, you drop comments. If you are following, if you are not following, ask. I can spell if you need spelling. Okay? And if it's too much, I can take some time, but I'll definitely reply your comment. Okay, so that you get it straight. Now, OD stands for organ. Study equation stands for space in bracket quadrangular space. That's example. A typical example of space is a quadrangular space. I know we have mentioned popliteal and cubital. There are still also spaces, but there are other spaces. Remember this acronym we are giving you. Any other structure that is in that family, you study it, you describe it in exams or in a viva this way. Any bone, whether upper and lower limb bone, whether tap bone, whether bones of the neck or bones of the head, okay, whatever bone, so far is in the human regional anatomy, guess what? It's a bone. Then we talk about many. Many stands for muscle. Many stands for muscle. Fail stands for FRASH. FRASH is spelled F bracket open RASCH. Now we have FRASH stands for femoral ring, femoral femoral artery, femoral ring, femoral sheath, femoral canal, and femoral hernia. That's what we mean by FRASH. FRASCH. Femoral ring, femoral artery, femoral sheath, femoral canal, and what? Femoral hernia. You follow? Comment if you follow. Drop on the comments. Answer me if you follow. Joint is for joint. Joint in the mnemonic is for joint in the topic. The examples of joint: shoulder joint. If you know one example of joint, type there in the comments. Alright, type it. Answer me. Can you mention one example of joint? Alright, we continue. We said board exam stands for breast, okay, or mammary gland. Breast or mammary gland. Then the next one is because. Because stands for bone. Brachial stands for brachial plexus and other plexuses. Anatomy stands for axilla. Anatomy stands for axilla. Anatomy stands for axilla. Okay, I don't know if you're still with me. But of course, you should be with me. Okay, I tried to make it simple, slow. I would have rushed it over, but it has to start from scratch, little by little, one block upon the other, one expression upon the other. Okay, anatomy stands for axilla. Anatomy in the mnemonics stands for axilla. Always in the mnemonics stands for arches of the foot as well as that of the palm. Feel stands for femoral triangle. Feel stands for femoral triangle. And then challenging stands for classification of joints and anatomical terms, planes and region. Anatomical terms, planes and region. A lot of planes. Okay, you hear of transpiralic plane. Okay, and transverse plane. A lot of plane. All right, and regions, epigastric region, hypogastric. There are a lot of terms: superior, inferior, caudal, proximal, a whole lot of things. Okay, so we continue. We continue. The next thing we look at is, let's pick one or two or three or four of these topics. All right, and then do what? Talk about their outlines. Okay, and then when we are done, we also look at that of thorax, abdomen, pelvis, and perineum. By 1st of August, we will start head and neck. We'll look at the outline of topics in head and neck. All right. But for the second in course work, thorax, abdomen, pelvis, and perineum, we're also going to look at them. So we are going to look at maybe 3 or 4 topics out of the 17 topics, which is filtered from 48 topics of the first in course work of upper and upper and lower limb. Now let's pick bone, for example. Let's pick bone, for example. Bone is a topic, and there are several bones of the upper limb, and there are several bones of the lower limb. Once we are done, we look at joints because that's actually what moves those limbs. The bones and the joints helps to move those, support the in the movement of that limbs. And maybe the next thing we would like to look at is muscle. So look at bones, we look at joints, we look at muscle. Are you following? Bones, joint, muscle. Okay. Because these are the things that move these things. Bones, joint, muscle. Okay. There's something I didn't mention. Comprehensive stands for cavity, canal. Example, adductor canal. Find it in the lower limb. Carpal tunnel, canals. Okay. Like femoral canal. Do you get? We look at bones, joints, muscle. Okay. And maybe we look at spaces. Look at 4 things in upper limb. Look at 4 things in thorax, abdomen, pelvis, and perineum. So, before we look at bones, I want you to take time, take out your time. Try and save from your memory. Pause this video, save from your memory. Okay, you are playing it back, save from your memory. Or you are doing what? Okay. You are, for example, you've listened to this and then you you want to try it on your own. Okay, this thing that they've told me, this thing that I've heard, okay, I want to try it, want to try it. So you try it, okay, you try it. How do you try it? You try to say the mnemonics over and over again, okay? You try to say the mnemonics over and over again. You try to write it out slowly. You try to make recording and teach it. You can send it. There's someone you can teach someone on WhatsApp. You can send it to me. You can join the medicine and surgery course mastery WhatsApp channel where you send a feedback of what you learn little by little. So somebody say, did they ask you to list all the topics in exam? Well, they may not ask you. There is a foundation. Do you understand? There is foundation. There are so many things you don't ask about, but they are very important. They are foundation. Now, we move on. As we move on to something else, we said that for second in coursework, the topics are just 4. Yes, as simple as that, 4. However, those 4 topics are further divided into about 30 subtopics. So it's just structures in the thorax, that's all. All right? But the first thing is thorax. The second thing is abdomen. The third thing is pelvis. Now, sometimes some people join abdomen and pelvis together because there's no anatomical structure dividing it together. So they call it abdominopelvic region. And then the perineum is the last thing you study. Now, Thorax is the chest. Thorax is the chest. The region between the neck and the abdomen. That's the thorax. So the thoracic cage, all right, the thoracic cavity, the thoracic inlet, what passes into the thorax and what passes out of the thorax into the abdomen, those are concerns. The blood supply to the thorax, the internal thoracic artery, the supreme intercostal artery, the, the cervical artery, cervical trunk, and the deep cervical artery. All those arteries. Now, when you are done with thorax, of course, before you talk about abdomen, there are auxiliary topics just about some structures. For example, diaphragm. Okay, you talk about diaphragm. What's diaphragm? Is the chief respiratory muscle. Okay, is the muscle responsible, okay, that aids in pushing up the thoracic cage, that's the rib cage, when you breathe in, and bring it down when you breathe out. That's inspiration and expiration. Do you follow? Thumbs up if you follow. Drop comments if you follow. Now, you that are with me, do you follow?
Yes, sir.
Okay. So we move on. Now, abdominopelvic region can be studied anatomically using outline, can also be studied with radiographic appearances. In fact, matter of fact, the radiographic appearances give more challenges than the other side theoretical challenge, because some people don't know the structures that are seen, okay, when the abdominopelvic region is exposed to radiography or to machines. So but we study abdominopelvic region in a very simple way. You study abdomen, you study pelvis. The abdomen is divided into three: LUM, lower abdomen, upper abdomen, and what? The middle abdomen. The upper abdomen has a region it begins from and has a region it ends. So it begins from the diaphragm to the transpyloric plane, where you have L1, as towards the L1, while the middle abdomen begins from L1 to where? To L4. The lower abdomen starts from L4 to the pelvic brim. Yes. Don't worry, when we'll be looking at them in detail, we'll take time to talk about these things. While the pelvis is divided into three, study pelvis in three ways. The first two ways is true pelvis and false pelvis. Then the third thing you study in pelvis is the pelvis brim. So you look at, as you're looking at pelvis brim, you look at the definition. Some people look at boundaries, okay? Now, you look at the location, okay? You look at the content and the clinical situation. That's all. That's all. Or you can say, you look at the definition, look at the radiographic image, and then you look at the clinicals. That's clinical significance. Now, moving away from there, we said you have the perineum. Perineum is a region containing what? The anal orifice or the anus and the external genitally anteriorly. That's the part that gives the small anterior urogenital triangle. Yes, there's a triangle there, just like you have triangular space, lower triangular space in upper lip, higher upper triangular space in upper lip. You also have large and small triangular space. The large triangular space is the posterior anal triangular triangle. the large posterior anal triangle, whereas the one that is anterior is the smaller anterior urogenital triangle in the perineum. So perineum is the region between the limbs, okay, just before. Upper and lower limb, what do you have? We come back to upper and lower limb. Like I said, I won't talk about head and neck for here. Okay, for now here, look at head and neck from 1st of August. So we have bone. We have bone. Now, how do you study bone? Give me 1 second. I'll be with you. Let me take some water. All right, so I'm back here again. Back here again. So we are talking about bones. Okay, before now, I have about 10 outline for bones, discussing bone. For now, I have 10 outline for discussing bone. Okay, 10 outline for discussing bones. About the now it's way over 15. Okay, here's the mnemonics. And don't forget the mnemonics for the topic. So Yeah. So that way you can say all your upper and lower limb is in your fingertips. That way you can also say all your second in course work in anatomy is in your fingertips. As simple as A, B, C. 1, 2, 3. Simple. Now you add up. As you add new concept, as you add new things, you do what? You remind yourself of the old one. That's what we call space repetition. All right. So we move to the next one. We have what we call boom. Here's the mnemonics for boom. I draw perfect pictures showing big mysterious lion on field and city. That's what I used to have before now. But I change it so that I need to add more topics, more subtopics. So when you are describing bones in exam, anatomy essay exam, theoretical essay exams, you'll be able to have enough to write. Okay? And so in anatomy, don't worry, we're going to make a video on how to answer questions in exams in anatomy theory. Okay? If you are good in theory, objectives won't be a problem. Okay. All we need to do is to create sessions. We talk about question and answer in what? In anatomy. Question and answer in anatomy. We said I started drawing perfect picture showing some big mysterious lions. Showing some big mysterious brown lions on Jasper Field excluding sparkling cities. I'm going to take that again. I started drawing, say it with me. I started drawing I'm listening, say it now.
I started drawing perfect pictures showing some big mysterious
No, hold
brown
on, hold on.
lions on
No,
Jasper.
don't say everything. We are learning. We are learning. Because it's different from what I've taught, past session I study with people and you and all that. So I'm adding new thing now. So let's master it from scratch to mastery. Okay? All right.
Yes, sir.
So I said I started drawing perfect picture. Say it.
Pictures.
So I started drawing perfect picture. I started drawing perfect picture. Next one.
I started
Showing some big mysterious brown lion.
showing some big mysterious brown lions.
Okay, let's start from the beginning. I started drawing perfect picture showing some big mysterious brown lion.
I started drawing perfect pictures showing some big mysterious brown lion.
Let's add the last part. Listen to this. On Jasper fields, excluding sparkling cities. On Jasper Jungle's field, excluding sparkling cities. So we said on Jasper on Jasper fields, excluding sparkling cities. Can you say the last one? On Jasper field, excluding, let's do it again. on Jasper fields, excluding sparkling city. You do it. Say it.
On Jasper's sparkling
Now,
field, excluding sparkling cities.
on Jasper field, excluding sparkling
Just
city. All right. So we're going to say from the beginning. And if you are joining, you have to say your own. If you are replaying this, you have to say your own. See how we started the first one, the second one, start the first and second. We added the third one. We say the third one again and again. And we start now. We want to start from the first one to the third one. All right. So let's do that third one again. On Jasper
on Jasper's
field,
excel
excluding
sparkling city.
sparkling city. That's right.
Sparkling
That's right. Good. So try to say without looking at your book. Okay. First, I said it slowly. Okay. Next, I said it fast. Next, I say it without book. Next, I say it and try to say it and allow it sink in. Say and pause. It's sinking. Do you follow? Thumbs up
yes,
if you
sir.
are with me. Good. So the next thing we do is we look at we look at starting from the first to the last. We said I started
I
drawing
drawing
perfect picture.
perfect pictures
Mhm. I
showing
started drawing perfect picture. Let's say the next two. Showing some big
some
mysterious
mysterious
brown lion.
like
The last one. On
Jasper's field, excluding sparkling cities.
on Jasper field, excluding
Excluding
sparkling cities. So that
cities.
is 566. 566. The first one is five mnemonics, the second one is six mnemonics, and the other last one is six mnemonics. So we said on Jasper fields, excluding sparkling cities. Do you follow? On Jasper field, excluding sparkling cities. So let's run from the beginning. All right. Now, this is new to you as well as new to me because I told you what I used to learn about board was not always up to 10 points. Okay. But because you are expected to know a little thing about everything in that bone, you need to add new parts of those for those bones. So, but the mnemonics is always very important. And don't forget the first mnemonic we said. Please never ask very old student question. Break Many fail comprehensive joint board exams because brachial anatomy always feel challenging. Do you follow? And we say please stands for popliteal fossa, nef stands for nef or nef plexus, very stands for vein or very venous drain or lymphatic drainage, R stands for artery and anastomose. Now do you notice I'm rushing it because I take time to store it slowly. The same thing that for this bone now, as we learn it, also learn it. As we learn it slowly and repeatedly, also learn it slowly and repeatedly. So that when we start talking it fast, you also start talking it fast. When you start thinking it fast, you also start thinking it fast. When we start retrieving it fast, exam is asking you now, tell us about this bone. You can also retrieve, oh, bone, yes. This showing stands for sharp, yes. Status stands for size, okay. This one stands for, do you get? All right, stand for surface. This one stands for, so as we are starting it, also start it. The same thing when we also talk about thorax, we talk about characteristics of thorax, composition of thorax, talk about blood supply of thorax, talk about the supply to thorax, talk about the, do you get, you also full. So whatever we are doing, do it slowly with us. So don't say, ah, it's very simple. I've known this before. Don't put it's getting complex. So and we are building this foundation for you to springboard. Or just you for us to springboard. Okay, let's move on. Now we are saying bone. Okay, the last part, which is very new to me, okay, and also new to you, is on Jasper fields, excluding sparkling cities. I get it now. Do you get it? If you don't get it, pause it and get it. Hey, do you get it? You that with me on this live session?
Yes, sir. Yes, sir.
Okay, say it. Say the last part for the bone. Say it, let's hear.
On Jasper's field, except
On Jasper field, excluding sparkling cities. So on Jasper field, excluding sparkling cities. You see, when you learn, yes, those of you that are replaying this, when you learn, you use your body, you use your so but when time you use your voice, it's not see, this is not where they say read in your mind. When you know where you are reading is noisy. Like now, if not that other students are sleeping, this place will be noisy, you know. Some that began the study with me have already gone off. Good. I love what this person did. He wrote it in the comment. So you too can write in the comment on Jasper Field, excluding sparkling cities. Beautiful. So now let's start from the beginning. Later we'll say what this thing stands for. Okay. We say to discuss bone in exams, theory, you use outline. And to remember that outline, you need one secret. You need one secret. And the secret is I started drawing perfect pictures. You said 566. The first five is I started drawing perfect picture. Okay, showing
yes, sir. Throwing some big mysterious brown lions on Jasper's field, excluding sparkling cities.
hello. Can you hear me? Good. So we are still talking about an all right. We started by saying the anatomy of the upper limb. Okay. Mute yourself if you are not talking, so it doesn't react. Okay. Mute yourself if you are not. When you want to reply, you mute yourself. Okay. So we move on. All right. We said anatomy of the upper and lower limb. Okay, has 48 topic. We can discuss it in so we are still talking about anatomy of upper and lower limb, anatomy of thorax, abdomen, pelvis, and perineum. Okay, we will add anatomy of head and neck from August. Now we said anatomy of upper and lower limb is not difficult. 17 topics out of the 48 topics. Look at it from 17 topics. Simple as 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, like that, like that. The mnemonics is please never ask very old student questions. Okay? Many fail comprehensive joint board exams because brachial anatomy always feel challenging. That's all. That stands for popliteal and cubital fossa, nerve and nerve plexus, vein and venous drainage, lymphatic drainage, organs, arteries and anastomosis, spaces, example, quadrangular space. The main stands for muscle, fail stands for FRASH. FRASH is spelled FRASCH. That is femoral ring, femoral artery, femoral sheath, femoral canal, femoral hernia. And then we talk comprehensive stands for cavity. Joint stands for joint. Example, shoulder joint, elbow joint, like that. You can even type in the comments what kind of joint. Type it. What kind of joint? Okay. Example of joint, not type of joints. It's a type example. There are several. Joint is about 10 topics out of the 48 topics. Now, check your own scheme of work and then write in the comment how many weeks is dedicated to teach joint in your school. Okay. So after that, you have breast or mammary gland. After that, you have a bone, you have brachial plexus or other plexuses. After that, you have after that, what else do you have? You have axilla, arches of the foot, femoral triangle, classification of anatomical terms and planes and regions, as well as joints. That's all. That's all. Now we are picking some topic. For example, we pick bones. Now, how do you discuss bone? Okay. We said bone. How do you discuss bone? We said bone is discussed under some topics. You discuss bone under 17 topics, subtopics rather. If they say talk about the humerus is a typical bone of the upper limb. Or they say bones in the pectoral girdle, like the clavicle and the scapula, they are the bones in the pectoral girdle. They join the upper limb to the thorax. They join the appendicular skeleton to the axial skeleton. Upper limb is your hand, limb. Okay, while the axial skeleton is made up of the skull, the neck, and the trunk. Okay, this trunk is the thorax. All right, so let's continue. We have that needed to take some sip of water. Okay, very important. You take water as you study. All right. All right. So we said there are 17 topics or sub outlines, 17 outline you use in studying bone. 17. 17 using studying bone. Okay. Now, one sentence or one mnemonic can help you do that. You keep doing it, you teach it out, use it from time to time, it becomes part of you. What's the mnemonic? Just like we have for the topics, that for bone is I started drawing perfect pictures. Say it again. I started drawing perfect picture. Sambo, are you there? Can you say it?
I started drawing perfect pictures,
That's
showing
good.
some big mysterious brown lions on Jasper's uh, field, except sparkling cities.
Good. So I started drawing perfect pictures,
Perfect
showing
pictures,
some big
showing
mysterious brown lions.
some
Take water.
on Jasper's field, except sparkling cities.
Is excluding. But if you are using except, is no problem. Excluding parcosity. So if you are using except, no problem. Let me take some water. All right. So I stands for diagram. Started stands for shaft. Drawing stands for diagram. Perfect stands for part. And then picture stands for position. So that is the first one. I started drawing perfect picture. That's what it stands for. It stands for introduction, shaft, excuse me, shaft, part, and position. Introduction, shaft, part, and position. Okay, introduction, shaft, diagram, part, and position. I started drawing perfect picture. I started drawing perfect picture. That's it. Now let's look at the next six. Remember, it was 566. So I started drawing perfect picture showing some big mysterious brown lion. Let's look at that some big mysterious brown lion. What do they stand for? The first some they stands for side determination. Side determination. So showing stands for side determination. Some stand for surface. Big stands for borders. Mysterious stands for muzzle, what some people call movement axis. So muzzle and the kind of movement it ensures. Brown is blood supply, and then lion is ligament, showing some big mysterious brown lion. The lion ligament, the brown is for blood supply, showing is for side determination. Some is for surface, big is for borders, and then M, which is mysterious, is for muscles. Do you follow? Please write in the question if there's one you want me to spell or the one you didn't get. Okay? Anytime you write and I come online, I will see it, I'll be notified, and I'll send you response. And you that is here, hope you got it up to this point, right? Because one of the reasons
Yes,
why we
sir.
are
Yes,
doing this,
sir.
because I believe some students are wondering, how do you internalize? You start somewhere. Now imagine this time you need to, because you see the problem is, imagine your exams is tomorrow. Imagine your exams is tomorrow, and you have a lot to read. If you want to forget 90% of what you learn, just read. But if you want to remember 90% of what you read, teach. If you want to remember 80%, engage in a study session like this. Do you follow? So that's why we said once you are done with study session own because what we get you to do is only 70%. It's only us that anchor the session that get 90%. You get your own 90% by dropping your own after the session. Go and study. You study. Sorry, you drop a audio. Okay, this is what I learned. But the snapshot, you write it out from your head. The one you miss, you open again, say, and do again. So you do again over till you get it. Do you follow? All right. So we move on. We said the last one now is I draw perfect. I started drawing perfect picture. That's 5. The next one 6 6. Showing some big mysterious brown lion on Jasper field excluding sparkling city. It's like I got it. I feel good. I see that's how you feel good. That's how you feel good when you also get it. On Jasper field excluding sparkling city. Sambo, can you try it before I say what they stand for? From the beginning to the last, from your head. So turn on your video so that I see that you're
Okay, sir.
not reading from book. Yeah. Turn on your video so you see you're not. That's how to internalize. That's how to master. So fire on.
Yes, sir. We have on Jasper's field, excluding sparkling
Start from
cities.
the beginning. Start from I started drawing. Start from that one till the last.
I started drawing perfect pictures showing some big mysterious brown lions on Jasper's field, excluding sparkling cities.
Thumbs up, thumbs up, thumbs up, thumbs up, thumbs up, thumbs up. Okay, so we'll be making reference. You see, now we are taking time to internalize. Now we are going to make a video where we say all these things we have done. 17 topics, outline for bone. We mix both of them together. And someone will say, how did he get to that level? It sounds like my prof. No, you too can get to that. You that is watching the replay of this can get, you can see somebody is getting it. So if we are consistent, we keep showing up, keep showing up. Tomorrow 9 a.m. we'll be studying again. 9 a.m. we'll be studying again. So please let's get set for study. Okay. 12:05 we are in again. And guess what? By evening we get to study again. Okay. By evening. If we start by 12:05. Okay, no. If we start by 9, okay, we use 2 to 3 hours. 10, 11, 12. Start by 12. Then we start by 2. 3, 4, 5. So 2 to 5 or 2 to 4. And then we start by 8 or 9, either 8 or 9 or 7. Usually Saturday we start by 7 so we can rest against church, prepare for church for those who are church, and then prepare for mosque for those who are mosque. Okay. All right, so let's be consistent. So now, ON stands for Ossification Center. Remember, on Jasper Jungle Field, excluding Sparkling City. On Jasper Field, excluding Sparkling City. Now, ON stands for Ossification Center. Jasper stands for joint. Everyone has joint. Okay, just like every joint has. Do you get the point? All right. So we said I started drawing perfect picture. Okay, next one, showing some big mysterious brown lion. Next one, on jasper field, excluding sparkling cities. Okay, all right. So the on is ossification center. The jasper is joint. What else is there? On jasper field, field is features. Everyone has peculiarities or features, special features. Okay, on jasper field, excluding stands for ends. Everyone has upper end, or we call extremity, and lower end. Okay, all right. So there's something, the upper end is called upper diaphysis, lower end is called lower diaphysis. And where the shaft and the diaphysis meet, either proximally or distally, that is either at the top or at the bottom end, we said it is metaphysics. Now we move on, we said the next thing now is we have talked about bones. Let's look into joints. How do you discuss joints? Before now, I used to discuss just few topics, few subtopics I used to discuss. That is, disciple teaches all Christian love. Bible reading now more accurately. I'll take that again. Disciple teaches all Christian love. Bible reading now more accurately. That's 10, right? But now I'm going to tell you new ones that I've learned to make it at least 15. Okay? Because most people will say, oh, please do for 15, because they will ask if 15 people you write 15 and all that. Okay? So let's go. Are you ready? Take a deep breath and get ready. Drop a comment if you are with us while I take some sip of water. All right, so let's go for the mnemonics for joints. I always see various born again believers. No, not born again believers. I always see various born again disciples teaching all Christian love. Eventually, Bible reading now more accurate. How many is that? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16. No, it must be 15 at least. So let's go for this one. I always see various born again believers, sorry, disciples. Say it. Say it again.
I always see various born again disciples.
Okay. I always see various born again disciples, teaching all Christian love, Bible reading now more accurately. How many is that? Let me count. I born again disciples. That's the first one is 6. Let me write it. First one is 6. Remember for bones it was 566. Is it not? It was 566. That is I
It was five, sir. It
for
was five.
566. That is you divide it into like how do you call it now? Syllable. Okay. Divide into before you have a break. You have 5 words. Like so the first one for bones it was I started drawing perfect picture. 5. The next one is showing some big mysterious brown lion. That's 6. That's why I say 5, 6. And the last one is on Jasper Field, excluding sparkling cities. Are you seeing why I say it's 5, 6, 6? Do you follow?
Yes, sir. Yes, sir.
5, 6, 6 for
Yes,
bone.
sir.
Yeah. So 5, 6, 6 for bone. Let's see for joint. Joint is I always see various disciples. That one is 5 now. I always see various I always see various born again disciples. I always see various born again disciples. So the first one is 6. I write it down for joint. Teaching all Christian love. So that is 6 4 now. Bible reading now more accurately. So 645. So joint is 645. Are you following it? So let me say it slowly so that you can get it. I always see various born again disciples. Say it.
I always see various born again disciples
Teaching all Christian love. Say it.
teaching all Christians.
Good. So
Teaching
I'm going
all
to say from the beginning to that point, you do the same thing. You are playing this back, you are with me, you do the same thing. All right? It's a principle. If you choose a number between 0 and 10, okay, if you multiply by 3, the answer, you add 3 to it, the answer, you multiply by 3, the answer should be two-digit number. In between the two-digit number, put a plus sign, add the first to the second. Guess what? You have 9. All of them. Whether you choose 1, 2, 3, 4, 5, 6, or 9, all of them. If you follow that principle, you have 9. So we'll make a short clips on this. Do you follow? Now we move on. I'm not going to say from the beginning to where you stop. 6, 4, what? 5. Joint was what? 645.
645.
I always yes, joint was 566. Joint was 566. Now, sorry, bones was 566. Okay, let me take some water. You know, the weather is very desiccating, very dry. All right, so we have that I always, I always see various born again believers. That's 6. Teaching all Christian love. If you notice someone that is born again, they will go on evangelism, teaching all Christians to love their name. Is it not true? So we this mnemonic came out of a feeling of religion. Oh, God help my life, and God helps you this way. Okay. So now I always see various born again what? Disciples. Teaching all Christian love. Now say it from the beginning to that place. Before verse 5. Say it like 3 times. Let me take water. It's better, it's very, very dry here. So say 3.
I, I always see various all Christians love. I always see various born again disciples teaching all Christians love. I always see various born again disciples teaching
All right. I always see various born again disciples. I always see various born again disciples teaching all Christian love. Now, the last one now, Bible reading now more accurately. Bible reading now more accurately. Bible reading now more accurately. I always see various born again disciples teaching all Christian love, Bible reading now more accurately. Okay? So can you say it? The last three now. As the last five, sorry. 6 4 5. Say the last one. Like two times before.
Bible reading now more effective. Bible
Now more accurately. Bible reading now more accurately.
Bible reading now
Okay. Can,
accurately. Bible reading now more accurately.
okay. Can we say from the beginning to the last? Let's learn from that place. From the beginning to the last. Use. At it from beginning to the last.
I always see various born again disciples teaching all Christians love. Bible reading now more accurate.
I'm going to do something now. I'm going to give you like 1 minute. Write this mnemonic down. Okay. Both the one for joints and the one for bones. Okay. So start with this last one, the one
Yes,
for
sir.
write it out. Hmm? Mhm. I'm going to give you 1 minute, write it out. Yes, we recite it, but it's time to write it out. Just write it out. If you notice now, you are not copying, you are writing from your brain. See, that's how to sharpen the brain. That's how to gain the mastery. Write all the mnemonics out. When you finish, write what it stands for. Hmm? But don't write this last one because the last one I've not yet told you what it stands for. Yeah. So I give you 1 minute to do that. When you're done, you give me thumbs up. Yeah.
Okay, okay, sir.
My co-guest is, so I expect those of you are playing back to also do the same thing. You write out what you have learned. There's a time to reason it, recite it. There's also a time to write it out. Time to write it out. Okay? There must be a time to also write it out. Do you follow? So he's writing it out. Once he's done, we continue. Mm, yeah. I always I always see various born again disciples teaching all Christians that Bible reading now more accurately. Okay? Yeah. So that's how it goes. Okay. So now let's say what it stands for. I always see various born again disciples. I stands for introduction. We say in everything you are writing in theory, in anatomy, you start with introduction. So I always see various born again disciples. Always there. Like I said, always stands for articular surface. Are we following?
Yes, sir.
Yes. Always stands for articular surface. And there's something we did not include. That's the diagram. Did you notice? It's a rule.
Sir.
I said we didn't include diagram. It's a rule. Whatever you're studying in anatomy, you must sketch. You may not draw, find something, but you must sketch. So we're going to adjust that mnemonics now. Are you ready?
Yes, sir.
Oh, no, don't adjust it. Diagram is there. That disciple stands for diagram. Disciples stands for diagram. So let's go. I always see. Now, I is for introduction. Always is for articular surface. Okay. C is for stability. Have you written it? C is for stability. Ehen.
Yes, sir.
Always is for articular what?
Yes, sir.
Articular what? Always stands for articular what? Okay. Hope you've written
Art-
it. Okay. Hope
articular
you've written it
surface.
down. So we
Yes, sir.
various.
Yes, sir.
Various stands for venous drainage. Various stands for venous drainage. Now, you remember that venous drainage we talked about
Yes,
in the
sir.
topic? See venous drainage now. There's almost no structure that does not drain through the vein. It's almost. So if it's supplied by blood, you say you have blood supply, you must have venous returns. So bone, if it has blood supply, it must have venous returns. Very simple. So if it is not there, you can include it. It makes your outline much more. Okay. So we are going to close shortly this session by 11 so that we can rest and then move to something else by tomorrow. Is that okay? Tomorrow we start by 9.
Yes, sir.
So we said I, introduction, always, articular structure, C, C stands for stability, various stands for venous drainage, disciple stands for diagram. Write it. Write it.
Sir, born again. What of born again?
Beautiful. Born again stands for bossa. Bursa. Bossa. Every joint has a bossa, although not all joints. Every joint of the upper and lower limb has bossa.
Yes, sir.
So the type stands for what? Hope you're writing it down. Write it down.
Yes, sir. I'm writing it down, sir.
Mhm. Then the next one is he said, always I always see various born again disciples teaching all Christian love. Now that teaching stands for type. So like you mentioned
Yes,
ball
sir.
and socket joint. Now that's a type of joint. It's not an example of joint. An example of joint is shoulder joint and all that. Elbow joint. So now let's continue. We said teaches all Christian. All day stands for articular structure. The other one was articular surface. You remember? I
Yes, sir.
always see that always was articular surface. This one now is articular structure. Don't mix
Yes,
it
sir.
up. Mhm. So I always see various born again disciple teaching all Christian love. Now that Christian stands for capsule. CAPSUL stands for capsule. Okay. And then Christian capsule love stands for what? Ligament. All joints have ligaments joining a bone to bone. Okay. Then the last one, Bible reading now more accurately. The Bible reading stands for blood supply. Remember, if there is venous drainage, there must be blood supply. Which artery supplies the blood? Which vein drains the blood?
Yes, sir.
So blood supply, Bible reading. Reading is relation. What are related structures around that bone? Okay. So Bible reading now. That now is nerve supply. That's why some people can feel pains because the nerve picks signal and sends signal. Nerve supply. Are you there now?
Yes, sir. Yes, sir.
So let's run through again from the beginning. Said, I always see various born again disciples, that's five, sorry, six, teaching all Christian love, that's 5 4. Bible reading now more accurately, 5 4, 6 4 5. So we talk about Bible reading now more accurately is muscle and clinical significance. Write it. Muscles and clinical significance. Right. Okay. Are you there now?
Yes, sir. Yes, sir.
Okay, so tell us from this point now, I always see various born again. Say from that to the end, the beginning of the mnemonics to the end, then also run through what it stands for. Okay, and then tell us about joints, tell us about the 17 muscles, 17 topics in anatomy. Run through those three things. Then I see if I can add for muscle. If I can add for muscle, mnemonic for muscle, and then mnemonic for scapula. If I cannot, maybe I'll make a video and send. So fire on. Because I want us to end by 11. I don't want us to take more than 1 hour, up to 2 hours in this stream. So,
Okay. So we the 17 topics on the anatomy. The mnemonic for it is please never ask old students questions. Many fails joint comprehensive board exams. Brachial anatomy fails. Brachial anatomy we move to
Move to bone. No, don't tell the meaning yet. Finish with the mnemonics. When you're done with the mnemonics, you start with the what they stand for. And what stand for will start from the last one we did, so you don't forget too much. That's how you build memory.
okay. Okay. The last one we did was the mnemonics for it was I I always see various born again disciples teaching all Christians love Bible reading now more accurately. Then we have I stand for John, always stands for articular surface. Always V stands for venous drainage. Born again stands for Bossa. Disciple stands for diagram. Teaching stands for type. All stands for articular structure. R stands for
Capsule. Let me help you. Now, this is what you do. This is
R
what you
stands
do.
for
Open fresh page in your notes. So that when you say mnemonics, and when you say mnemonics, you
yes,
can
sir.
write it out or put a letter to show the mnemonics. So that when you are not telling what it stands for, it will be easy for you. So that you don't need to be racking the brain to confuse mnemonic and what it stands for. You can open a fresh page, not where you jotted what we learned, but fresh page to now scribble maybe one or two short form concerning the mnemonics, and then you now list what it stands for. Yeah, do like that. So you can be talking and looking at your what you just wrote out from your head. Yeah.
Yes, sir. Sir, please, what does law stand for? Because I seems like I made a mistake.
Ligament. Love stands for ligament.
Thank you, sir. Okay, so we have the mnemonics, the mnemonic for the joint. We have I always see teaching all Christians love Bible reading now more accurately. We have I stands for introduction, A stands for articular surface, stability, uh, V stands for venous drainage, B stands for bossa, disciples, D stands for diagram, teaching, T stands for types, A stands for articular structure, B, Bible noun stands for nerve supply. M, more stands for muscle, stands for sick. I'm coming, sir. Then we have then we move to we have the mnemonics. I started drawing perfect diagrams showing I started drawing I started drawing perfect pictures showing some big mysterious some big mysterious brown lions in I as introduction started as a we have I as introduction, S as shaft, as diagram, pictures as position, showing as size determination, some as
Surface.
yes, some as surface, showing some big as blood, no, big as the border, showing some big also as lions as ligaments, jasper as joints, field as so jasper as joints,
Features.
field of course, yes, uh, field, excluding
All right. So thank you very much. Thank you very much. You've tried. You've tried. You are doing this for the first time, and I've been doing this almost every time. So what happens is, I'm going to release you to go rest. But before you rest, run through this again. What we have done, what you've written, the mnemonics, what they stand for. Write your test, then go to the medicine and surgery course mastery WhatsApp group, and then drop an audio. Okay, also drop a snapshot of what. Drop an audio only. Don't drop snapshots. Okay, because we're going to make a video clean snapshot sent to them in the video, short and this thing. This one is internalization session. Okay, so we are going to end here. Doing by tomorrow,
yeah,
we'll go again. We'll revise what we've done. I expect you to master these three. Let's not learn too much. Master these three mnemonics. Okay, by running through it over and over, writing it out, saying it, writing it out, going to the group to do it. Then by tomorrow, we'll revise it before we learn for muscles and spaces and maybe brachial plexuses, okay, or anastomosis. Is that okay? We pick those two because those are examinable
yes,
areas. Uh-huh. Then when we are done, we now get into thorax, abdomen, pelvis, and perineum. Is that okay? So you are here in this call. So share the link, subscribe so you can comment, so you can be able to also ask questions, give your view, share to your friends and share to people who are doing anatomy. They even if the person is in anatomy department, is doing anatomy, or the person is in physiology department, is doing anatomy. So let them join, let them get to watch this clip, let them get to learn. And if they need areas want us to explain, we are going to do it together. Is that okay? Now, this is how we used to pass through. For you to see wonderful shots we make on something, a wonderful video we make, this is the price and all that. And this is what YouTube, many YouTube, if I don't see any YouTube video that show it this way. You only see, learn this in 5 minutes. Okay, but we are going to show you both learn this in 5 minutes. That's presentation. Okay, that's just presentation. But this is the internalization. Okay, measures we use to do what? To internalize medical concepts. That's why I say MSc mastery. That is medical medicine and surgery course mastery. How do you master it? This is how. This is how. Do you follow? So it's almost 11 o'clock. I'm going to end before that time. So thank you very much, you that is here with me live, and others who will be playing this back. In fact, you will be playing, because after now somebody will be playing it back. Okay, we'll be playing it back, and other level students will be playing it back. This will be for years, will be for life. And then we say thank you, comment, subscribe, share, and then teach someone, okay, and be a blessing to someone. Once again, thank you. See you tomorrow.